Good morning. It's Thursday, June 10th. Welcome to the Doctor's In, Ask Dr. Arwady. I'm Sybil Madison, Mayor Lightfoot's Chief of Staff. I'm here with Dr. Allison Arwady, our Commissioner for the Chicago Department of Public Health.
Good morning. Thanks for joining.
Here's where you can get the latest on COVID-19 and vaccine here in Chicago. We look forward to answering your questions, and you can put them in the chat box below. You can also send them to us through Facebook or Twitter using the hashtag AskDrArwady. We are, we gotta check the distance.
Yep, we're still good.
We're still doing that. And we're gonna dig right into the data.
We are. And everybody is in a very good mood around here because our data is looking so good and we are really excited looking ahead toward reopening phase 5 tomorrow. Everything, is on track and, it's exciting. It's the first time since March 15, 2020 that businesses would be able to operate without capacity restrictions and a lot of these restrictions in place. So let's take a look at the data because it's why we feel confident about being able to move ahead. So as always, you're going to go to chi.gov/COVID-, and I encourage you to go there and look right along with me. So as we pull this up here, you see a lot of green, which is good. Our daily cases are at just 79 new cases per day, every day. It's really amazing to be sitting under 100 cases when at the peaks we were averaging more than 2,000 cases a day. We had days over 3,000, even 3,500. And you can see even just last week we're down 41%. So seeing those numbers, dropping so quickly.
That was
exponential decay.
Yes.
We sometimes talk about the fact that when really epidemics work like money and interest, that if you save your money, it can grow very quickly, right? And it can also, you can lose it quickly too. But this idea that each case that is fewer that does not transmit can break whole transmission chains. And so you can really see this kind of movement when things are in a good place.
That reminds me of the R-naught.
Yes, exactly. Our R-naught is well under 1. Our R-naught, and if people don't remember the R-naught or the RT, which is the reproduction number, when that number is 1, it means for every one person who has COVID, they transmit it to an average of one other person, okay? And if the R is over 1, it means on average every one person with COVID is transmitting to more than one other person. And when you're seeing that R over 1, that's when you are seeing major increases. But if the number is less than 1, every one person with COVID, they're transmitting to on average less than one other person. And our R-naught has been in the 0.7 to 0.85 range for the last couple of weeks, which is really good. So it looks great. Our hospitalization numbers also, you can see here, we're averaging 8 Chicagoans getting admitted to the hospital every day. So we're not done. But if you look, that is down 67% from just a week ago. That has also, you can see on the graph here, been trending down really nicely. And if you look at the rates, we're seeing fewer than 3 cases per 100,000 population right now, and then 0.3 people per 100,000. So 1 in every, more than 300,000 Chicagoans getting admitted with COVID. So just really good progress. Our deaths are still at 5 per day. We expect that to lag a little bit because we are still seeing the outcome from that bump that we had over April and May. But when you have so many fewer people getting admitted to the hospital, right, where you look a few weeks down the line, that number we do also expect very much to drop. And then if you look at our vaccinations, you can see we're back up to almost 10,000 a day, which is good. But to talk a little bit about what's driving that, you can see this nice little bump. That is coming about 3 weeks after our bump here, which was when the 12 to 17-year-olds became eligible for vaccines. So a lot of that are those kids getting their second doses, which we're pleased about because it means they're more fully protected. But it's been good to see this, really come back up, and we're hoping to keep it up in this range if we can over the next few weeks. You can see we're still testing about 7,600 people a day, and our positivity is at 1.4%. How about that?
That is It's like, I don't even believe it.
Yeah, I know. And down from 1.9% a week ago. I encourage you to continue exploring here. You can look and see what vaccinations look like. You can look at vaccinations, for example, by race ethnicity here, where we see among people of all ages, about 60% of white and Asian Chicagoans have gotten a first dose, about 43% of Latinx Chicagoans, about 36% of Black Chicagoans. More than 2/3 of the vaccines that we did last week in Chicago went to Black and Latinx Chicagoans. So we are making progress here for sure, but there's still a long way to go. And that's why, as part of Protect Chicago Plus, we're putting extra efforts in our less vaccinated communities. I encourage you to continue, explore this. You can look at vaccines by zip code. You can look at cases by zip code. You can see where we're making progress, where we're putting extra efforts. But all of the news on here is good. And certainly on the vaccine front, even as we move toward reopening, in no way are we moving away from, the work, and especially that hyper-local work of bringing vaccine to communities. And so if people have questions about what does this look like in this next phase of vaccination, we'd be happy to take those and talk in some detail about what's happening with pods or what's happening with outreach, door-to-door canvassing, anything like that. So we can come off of the dashboard here. And I think just one note that I wanted to say is that we did get some early data back from some of the canvassing work that we've been doing. So just as a reminder, in our 13 least vaccinated communities right now, we are working with community-based organizations, some of the aldermen's offices. We're working with some of our Protect Chicago Plus contact tracing core, some volunteers who have literally been going door to door, knocking on every door in these communities. And hopefully people answer the door and then they have this conversation about vaccine. They've all been trained using the Vaccine Ambassador Program. Reminder, ccc.edu/vaccine ambassador. If you want to take it, it's free. And it's meant for people who don't have a medical background, live here in Chicago, and want to be able to answer questions and talk to people about getting vaccine. So there was some work. We've started in some of the least vaccinated zip codes and then some of the least vaccination portions of that zip code. And for example, I was looking at one of the teams that was out in these first couple of days in Englewood, which is our least vaccinated community overall. And the data looked really good. About 30 to 40% of people did open their door, which is great. They're home. People are wearing the vest. They're identifiable as Protect Chicago. It's people often from community-based organizations in the community. And of the people who opened their door, 98% were not vaccinated in terms of really making sure that folks are getting in, having that conversation. But then more than half of them were willing to get vaccinated. We signed people up on the spot for a vaccine appointment. We set some people up with at-home vaccination, or there were some people who didn't want to make an appointment but wanted the information and said they would come when the bus was available. We were sharing, some of the opportunities in neighborhoods. And so for me, and that was just a section. It was I think 150 something homes that this group had done, but it's really an indication that this work that we're doing, although it's very resource intensive, it is important because these are folks who many of them are willing to get vaccinated, right? But making it available, making sure people know how to get that is really key. And so thanks to everybody who, has taken that Vaccine Ambassador course. And if you're interested in volunteering, you can reach out and be part of that group that is doing some of the door-to-door canvassing. We're especially focused on these 13 neighborhoods, but I think as we get other groups or other volunteers in, we would also like to do this in some other areas, and it's quite straightforward. There's a series of questions that you ask, and you do have to report the data in because we also want to understand if people are not getting vaccinated, why not? It helps us decide where to put our resources as we move ahead. And it's one more opportunity over the summer for people to be involved if interested. So we'll put in the chat the email and the contact information. But if you go to ccc.edu/vaccine ambassador, there's more about that.
All right. So yes, great news. Work is not done.
Work is not done.
And we know there are a lot of people out there who haven't been vaccinated yet, not necessarily because they don't want to, but they just haven't done it yet.
Right.
So we'll continue to get everybody their shot.
That's the goal. We're still very, very much on this.
All right, ready for questions?
Yes.
Alexandria Deanne from Facebook. Everyone in my TikTok feed is doing a challenge where they put a key on the arm where they got the vaccine and it sticks. Also seeing magnets and quarters. Is there something to that? What would be causing it?
Yeah, so thank you for that. This is one of the more recent myths that has been circulating around the internet. There has been, this is related to the misinformation that there is a chip or something that is tracking in some way in the vaccine. There is nothing magnetic in the vaccine. We've talked about what is in these vaccines. There's really very little. There's the instructions to teach your immune system how to fight off COVID, and then there's a little bit of a fat layer to help make sure that that's protected. There's a little bit of salt and sugar to make sure it's at the right pH and it works with your body, and that is it. So these are false, and it's certainly possible. If you put your arm just right and you put a little bit of this here, but try it yourself, and you will see that there is nothing magnetic in anybody who has been vaccinated. If I had a magnet right now, I'd put it on my own arm and show you that for a fact. So yeah, thanks for that, because it's this is the kind of misinformation where people still we know that there are people who still think that there are nefarious or tracking information, and clearly there is not.
Yeah. Okay. Mark Villanueva from Facebook. Does CDPH track and share data on updated real-world effectiveness of the 3 vaccines we use against the current variants and possible future variants? Thanks.
Yes. Okay, good. That's a pretty big question,
yes.
But it's an important one. And let me maybe just take a step back and explain a little bit how we are following this. So every time at this point someone is diagnosed with COVID-19, we are matching their COVID-19 test against the vaccination database. So if someone is diagnosed with COVID, we look back and see, was this person vaccinated? And if so, did they get both of their doses, and what is that timing like? And we do the same thing if someone is diagnosed a second time with COVID, which doesn't happen very often. But in both of these cases, either if we see someone be diagnosed with COVID a second time, or we see them diagnosed with COVID after having gotten vaccine, both of these are quite rare, but they both are signals for us that that could be a variant, or it could be something of concern. So that's where we're wanting to put our additional efforts related to, for example, looking for variants. And so we've been working with Rush University and some of the other universities to make sure that we're being very collaborative. We're creating something called the Regional Innovative Public Health Laboratory with some CDC funding. The opportunity for us to do more of this genomic work and follow-up is important. So where possible, we are collecting samples from those folks. Our team is doing, of course, we continue to do all of the case investigation and contact tracing that we've done all along. And as numbers go down, that actually becomes, in my opinion, more and more important, because we can really see more how this is spreading and where there are variants, make sure people have that information. So that's a little bit of background. We also, there is work happening to make sure that there is some more general surveillance that's done, meaning that samples of COVID tests in general are also being checked for these variants. And this is something that's growing across the country. We contribute to the national database there. And so that's how we know, for example, that all of the known variants of concern have been identified here in Chicago. We got a question, you weren't here on Tuesday, about the Delta, which is sort of the newest one that WHO has named a VOC, a variant of concern. And I looked up the data. We'd had 15 cases at this point of that variant. And the Alpha variant, which is the one originally detected in the UK, is now our dominant strain. Most people in Chicago and across the country are now getting infected with that variant. And so we look at an individual level to see, and the good news is at this point, we have not seen variants be more represented in people who get hospitalized or die. We have seen, 97% of the people who have been hospitalized since January, when people first had the opportunity to be fully vaccinated. 97% of the people in Chicago who have been hospitalized and 98% of the people who have died were not fully vaccinated. But we do, we look at those breakthrough infections.
And does that help us understand the effectiveness of the vaccine? Because he has this question about the effectiveness
Exactly,
here.
right. So that is a sort of an indirect way of looking at the effectiveness of the vaccine. We do look at, for example, which vaccine people received. We've not seen here major differences there. But to also study this, you want to do studies, right? Yes. And so, for example, there was a study that just recently came out of the UK that looked at about 12,000 people, and these were people who had some of the breakthrough infections, who had been diagnosed with COVID, to really understand and do a lot of this analysis. And what they found was that the Pfizer vaccine, which was the one they were studying, remained very protective, 91% protective against that Alpha, that B1 variant, and against the Delta variant, it remained in approximately 89% protective. So a little bit of a drop, but still generally very protective. And this was a good study where you're following people and matching up their vaccine and their records. But one interesting thing is in that study, they saw that one dose was not very protective. So one dose of the Pfizer vaccine for the Alpha variant, the UK variant, was only about 51% protective in the real world, right? Not that different from what we saw in the studies. And one dose of Pfizer against that Delta variant, the one from India, or that was first found in India, was only about 34% protective. Wow. And so it was overall, the conclusion of this was that, the vaccines, the Pfizer vaccine remains protective broadly against this variant, but you got to get both doses. And, they were comparing their Pfizer versus AstraZeneca. Pfizer was a little more protective, right? There's a lot of these kinds of studies that are happening around the world. But broadly speaking, the news remains good about vaccines. All three of the vaccines that we are using here in the US do remain protective against the known variants, although you see that protection drop a little bit. But it's important to get both doses. And every single time a variant emerges, all of the vaccine manufacturers, they're testing and looking in the real world. Because if we have a vaccine that turns out to not be protective against a variant, that would be a big deal. Yeah. So. Yeah.
All right, that was a great.
That was a lot, but I hope it was helpful.
Mark.
Yeah.
Paul Fine from Facebook: if you were vaccinated and then later exposed to COVID, does that make you more immune with each such exposure? So if you've been vaccinated and then you get exposed, does that exposure boost your immunity?
Very interesting. So I don't think we have a full answer to this question at this point. In most cases, because we know it the other way a little bit, that if someone has previously been exposed to COVID, they have natural immunity, that may not be as long lasting, et cetera, and then they also get vaccinated. We've seen some good data, which I've shared here, that their protection levels are particularly good because you're able to not only get the protection from the vaccine, but your body has had that chance to also develop some of those type of antibodies. The other way, the question would be, do you actually sort of get an infection, right? And in the great majority of cases, people actually don't get infected. And so I wouldn't really think that broadly speaking, unless you actually got infected, your body isn't going to have the chance to really sort of learn from that exposure in the same way. But on the other hand, you didn't get COVID, so this is a good thing. It's an interesting question. Yeah, I will kind of keep my eyes out for people that look at this. But broadly, I would think the answer would be no, because the vaccine actually is so protective in the real world. It's not really going to have a chance to be there. And even if people get get a breakthrough infection, we have seen a lot of data already that those tend to be much milder. They have less virus actually in their nose. So do you know what I mean? There's differences in even the way that the virus itself presents in someone who has previously been vaccinated. The CDC just this week released its next round of data. There's this study that they're doing called HEROES, or Heroes Recover, where they're following healthcare workers, essential workers, people who are at high risk for COVID, and they screen them. Oh, my Siri. Yeah, it's my watch. They screen them every single week. So they're actually swabbing them and seeing, do they have COVID, even if they don't know it. And what they've found is that even in people, the small number of people who do get COVID after getting a vaccine, many of them are asymptomatic. Their ability to detect virus, it's about 6 days less long.
Wow.
Their symptoms are much lower. So even in that way, I would, you're kind of not having as much of an immune response probably after vaccine. That's a good question, though.
Good question.
Yeah.
Here's another question from Namrata Batra from Facebook. I finished my vaccine in the last week of January, so I'm coming to my 6-month mark. What is the data saying? Am I still protected?
Yeah, the data is saying you are still protected, for sure. In fact, the data has been really reassuring on this front. All of the companies have continued to follow the people who were in the earliest stages of the vaccine trials. And just as an extra point on this, Pfizer, for example, has already been able to submit all of the data to the FDA for that full approval. It's been under emergency use authorization because it was an emergency and we wanted to make sure people could access vaccine, but that you need to be able to submit at least 6 months of follow-up. And so they completed the 6 months of follow-up, they submitted it, and the protection levels remained very, very good. At this point, a similar question we sometimes get is around boosters, et cetera. There is no booster recommended at this point for anybody in the United States, anybody who has been fully vaccinated. And we will see. Some of the people, the earliest people to get vaccinated now are at about a year, right?
Wow, yeah.
Where you think about the very beginnings of the trials, and the data broadly has continued to look protective. I think it's more likely we would need a booster with the emergence of potential variants, or we may see some of that immunity wane. But at this point, if you've been vaccinated, based on what we know now, everything is still good, and you would have a high level of protection.
You can go. All right, so Ginny William, my 70-year-old aunt was vaccinated at Chicago State and lost her vaccination card. Can she get a replacement, and how? That's a great question.
It is a great question, I'm sure her aunt is not the only one with this. So, okay, couple things on this. Number one is that those cards are not just widely available, as you know. They actually are they're kind of regulated a little bit by the CDC. They go specifically with the vaccine. There is some work to make sure that there are not just additional vaccine cards circulating. However, when your aunt got vaccinated at Chicago State, her information, she got the card, but her information was stored in the Secure Public Health Registry. It's called iCare. It's at the state. And that data, just to put a finer point on it, is not shared outside of that registry. There's not individual level data that is passed on, or we don't do anything else with it. It's held secure. But we are able to access that registry to, show the proof of vaccination. So to answer the specific question, because you were vaccinated at Chicago State in particular, but really anybody, you can email COVID-19 vaccine at cityofchicago.org. And we will basically download your record for you and give you proof. You won't get another card, but you'll get proof that will work just as well, that you'll be able to take a picture of or bring with you. For somebody who maybe is vaccinated outside of Chicago State or outside of one of the city of Chicago sites, there's a couple things you can do. Number one, if you go back to that site or give them a call, whether you got vaccinated at a pharmacy, at a doctor's office, et cetera, they also can reprint you the proof of vaccination. Number two, if that doesn't work for for some reason, you can email the same number. We'll look it up. But sometimes it's easier for people if they've already, have a relationship. And then we are working with the state to make sure that there will be a way for individuals to be able to log in and access their own records, because that'll be something that'll be important, down the line where people are needing to recover this or needing to show electronic proof, for example, where we think, down the line to travel. So a number of things there. But for now, if you haven't taken a picture of your vaccination card yet, do that, because that is something, that is also helpful if you're out and about and you want to be able to show this. Yes. But you can email COVID-19 vaccine at cityofchicago.org while we're working on some of these other things to come down the pike.
Right. Just like you take a picture of your passport when you're out of the country, just in case.
Yep.
Maggie K9 from Facebook. Should parents of kids under 12 and therefore not yet vaccinated have their kids wear masks? And if so, under what conditions? Inside, outside, in public, with other kids, adults, households? Thank you.
Yeah, so I know there are a lot of parents wrestling with this. And, broadly speaking, first, it's great that you are vaccinated, and if all of the adults around the children are vaccinated, that's the most important thing in terms of really limiting risk for those kids. The CDC and CDPH continues to recommend that anybody who is not vaccinated wear masks, particularly indoors. And so I would say, if you're in a setting where you're not sure if all the adults are vaccinated, if you're out and about, et cetera, I would recommend that children or anybody who's unvaccinated sort of in these public spaces, especially indoors, be wearing a mask. I think where you're thinking about, families getting together with multiple children, what happens there, that is really going to depend on the conversation you have with that other child's family, right? And sort of your level of concern and risk, are there underlying conditions, et cetera. In my extended family, when everybody, all the adults in my extended family are vaccinated. The young children, of course, are not. But when we gather, we are not wearing masks. But we know that, the adults, I have a sense of what those risk factors have been for the kids. And none of the kids have serious underlying conditions either. So I think the risk is certainly higher indoors than it is outdoors. The risk is very low. I mean, if everybody is vaccinated, adult-wise, I would not have major concern. And I think, out of doors, people are going to make some of their own decisions, but the risk is much lower there. So if you're going to have your kids, playing with other kids who aren't vaccinated, the more you can do that out of doors, that is one way to limit risk. Masks certainly are going to help also in that setting. And just to put a little bit of a finer point on it, I do just want to reiterate that camps or daycares or situations where children are coming together, our teams are absolutely within their right to be setting masking guidelines or requirements. So if a sports team is saying, we are playing this indoor game and all children need to continue to be vaccinated, that is absolutely within their right to do that, and we are supportive of that, even while there is not a mask requirement in place, at the city level, for example. Does that make sense?
Yes, yes. I think you said need to be vaccinated, but you meant
I'm sorry, need to be masked, yeah.
Yes.
Apologies, thank you.
Got it. Okay. Jin D from Facebook. If it turns out that we need to get booster shots in the future, we just talked about boosters, will we need to get the same vaccine as the first dose? So if someone initially received J&J, in a year or two, can they get Pfizer? Yeah,
another good question that we don't know the answer to. And in fact, this may end up being something where we actually would recommend getting one of the other vaccines. And there are some studies happening about that as well. The scientists around the world are really trying to look ahead here, to think about how to follow people and answer these questions for if they are needed. So again, no booster shot at this point is recommended. And if one is recommended, I don't expect this to be in the next few months, just to be very clear about that. I think it would be more potentially down the line as we learn more about how immunity may wane. But these questions of who and what and details, we just don't know yet. So I don't want to see people thinking, I got the Pfizer vaccine back in January, let me go get a J&J right now. That is not indicated, is not recommended. And if there is a need for boosters in the future, they will also be widely available, I would expect, right?
Yes.
This is different than when they were first coming around the first time. There is a lot more capacity to manufacture vaccine now, and they would probably be available, like flu shots are. So, to come, but no time very soon, I don't expect.
Yeah, it's interesting too because, I think you've said before, the flu shot changes every year.
Yes.
And so these boosters wouldn't necessarily be.
That's right.
Right, the same.
That's exactly right. Yes,
that we got the first time.
Yes, thank you for clarifying that. If it is in response to a variant, that's exactly right. The whole point would be if a variant emerged that the vaccine really was not protective against, you would actually need to alter the message in that vaccine. And the good thing is, like with the mRNA vaccines, the Pfizer and the Moderna, they have the technology to do that. There wouldn't be a new introduction of a new type of vaccine, but you would be able to give slightly different instructions, that message, that messenger RNA that teaches your immune system how to fight off that variant. And so at all of the pharmaceutical companies, they've been working on that technology. So yeah, it wouldn't probably just be, oh, you got the Pfizer before, get a J&J. It would be, you actually need the booster. And the difference with flu is that it is actually all about variants, although we don't always use that word. We use strains, mutations, but influenza, there are many, many, many different strains, and they change like crazy. And so every single year, we make a new flu vaccine that helps protect against the variants, the flu variants that are the most common, around the world that season. And that's why, it's part of why the flu vaccine is not as protective as the COVID vaccine is, because you're making your best guess based on sort of those variants. COVID has not mutated anywhere near as quickly as flu, thank goodness. And so the question of how long immunity will last, we're still learning about, but it is much less, it changes much less quickly than influenza does, which is good.
Yeah. Here's a question from Gina. Every country after relaxing, they are facing another wave of COVID. Are we ready to face another wave of COVID a few weeks after phase 5?
All right, so Gina, I appreciate your worry. We really feel very confident about these next few weeks here in Chicago, here in Illinois. So different, where you think back to before there was a vaccine and we were often having to make these decisions about turning the dial and sort of opening and reopening and how many people can be in spaces and what that protection is. That was because we knew there was an amount of COVID and a widely susceptible population. At this point where, we're coming up on 2/3 of adults having gotten at least a first dose of vaccine, there is much more protection broadly, and our numbers are so much lower at this point that there are many fewer chains of transmission. And so where we're able to sort of do that contact tracing, if these, 78 people per day are being very careful about, their own isolation and, working on that, that also helps cut these chains of transmission. All of the modeling, literally from every modeler in and around Chicago and Illinois, looks very good, where we look in the short term, sort of over the next few weeks, over the summer. And partly we know this because this really dramatic improvement has been in the context of significant reopening, right? Like if you've been out, you see those restaurants are very full. You see people emerging. We've had a lot of activity, even while we haven't been fully open, over these next few weeks. And that has been an opportunity to sort of turn that dial, make sure things stay in control and are heading the right way. So I am not concerned in the short term about a major surge of COVID. Certainly I am concerned about people who are not yet vaccinated, that they remain at risk, but the risk is lower. I don't know what will happen long term. I really don't. I think there could be some seasonal component to this. So in the same way we think about the flu season, as really being a fall winter, could that turn out to be, how COVID comes back? If that happens, it would land on unvaccinated communities and unvaccinated social networks. Time will tell, I think, related to that. And variants do remain a question as well. But we have not broadly seen, when countries have been opening in the context of vaccine, which is new, right? You look at Israel, for example, the most vaccinated larger country, things have remained in fantastic control actually there. And where we are seeing some surges around the world, they tend to be in settings where vaccine is really not widely available.
Yeah. Okay, got a little something in my throat. All right. Todd, can you comment on the CDC tracking only breakthrough cases resulting in hospitalization and death? Wouldn't monitoring all breakthrough cases help us better monitor vaccine efficiency and new variants?
Oh, sure. Okay, a couple things on this. Again, breakthrough infection is the unusual setting where someone develops COVID after receiving a COVID vaccine, because no vaccine is 100% protective. Even this is one of the best vaccines. It's about 95% protective, 94, 95, the Moderna and Pfizer in the trials. And so a few things. Number one, in Chicago, for example, we are doing that work of matching every individual case with the vaccine history, which is a lot of epidemiologic work, and that level of data is actually, the CDC does not have that level of data. They don't get the individual name of somebody.
They can't track
They
at
actually
that level.
could not do that. So that's why it's important that places that have some more epidemiologic capacity, are doing that and then are sharing that information. And there is some work to, to look at this in some sort of focused study ways. But you want to be careful that if you're looking for something like a breakthrough infection, you're actually doing that in a systematic way. So like that study that I was talking about that CDC has been doing, they're literally swabbing people every single week, and you identify some people who didn't even know they had COVID, right? Who are asymptomatic, and although their viral level is very low, they're not likely to spread it. That would technically be a breakthrough infection. So you worry if you were to try to track kind of breakthrough infections. If you're not regularly testing for people, you could miss some, right?
Yeah.
This is one of the questions. So that's being done more in a study setting or in individual settings, like here in Chicago. The important thing of looking at breakthroughs for hospitalizations and deaths, that is really important, because the main reason we vaccinate is to protect against these severe outcomes.
Right.
And just like I mentioned, any case that's resulting in hospitalization or death, is that potentially related to a variant? Do we have a change in COVID that is making people sicker, right? For example, and then just understanding how COVID is interplaying with other diseases, right? Like, for example, we've learned that people who have severe immunocompromise, like if they're undergoing an organ transplant, like right now, or a bone marrow transplant, or are on very heavy immunosuppressants, although some of those people get protection from the vaccine, they don't all get protection from the vaccine. And so understanding, right, where people are getting sick, how that's interplaying, I think is really important. And at the end of the day, for me, knowing 97% of our hospitalizations, 98% of our deaths are in people who are not fully vaccinated, that helps me know the vaccine is working very well. If we were to see that drop a lot in Chicago or at the national level, it would signal major concerns, right? And so I think that's why they do it. And it's the ability to track. It's the same thing we do for flu. We don't track every flu case. We have studies and surveillance in place broadly for flu, but then we do track at an individual data people admitted to the ICU, for example, or who die of influenza. The severe, yeah.
All right. Here's the last question from Maggie K9. Why do private businesses require staff to wear masks, but patrons are not required to do so?
Okay, so if we take a step back, in the state of Illinois and in the city of Chicago, there already is no longer a mask mandate. However, we have continued to recommend, as has the CDC, that people who are unvaccinated wear a mask. And we, particularly in this bridge phase that we've been in for the last month, we were definitely encouraging settings that were not asking about vaccination or not checking vaccination. The safer thing in that setting would be, or the easier thing might be, to continue to require masks. I think, particularly as we move into phase 5, we are going to see, I expect, more businesses, making their own decisions around this. And I think an employer is particularly concerned about their employees, right? Like, there is some level of responsibility there related to employee safety, which is why we've seen a lot of employers be part of our employer-based vaccination clinics, really encourage their employees to get vaccinated. And I think I've been very pleased to see a lot of businesses in Chicago sort of tout their employees' vaccination status, because then everybody knows it's a safer place. There's a dentist up by me that very much is promoting all of our staff are vaccinated, right? Like that's a very safe place to come and get my dental work done, for example. But it is going to be up to an individual business. And you could imagine there may be people who feel more comfortable seeing staff masked, like at a restaurant, where there are people who still have worries. If you're going to be interacting with staff, that could be something that a restaurant could require. And that is up to the business, just to be clear. That is not a City of Chicago requirement in any way, but we do encourage people to, in the same way that individuals are making their own decisions, businesses and establishments who have the opportunity to talk to their own staff, understand what their staff's concerns are, will probably make some different decisions in the days, weeks, and months to come.
Yep. All right.
All right.
I know we started with good news.
We started with a lot of good news.
A little bit of good news.
Yeah, absolutely. So one piece of what my staff certainly considers good news is that once we move into phase 5, we are only going to be updating our data portal Monday through Friday. So we are giving our epidemiologists Saturday and Sunday off. They will continue to, we monitor the data every day behind the scenes, but it is a lot of work.
So much work.
It is so much work to have all of this, we update every single figure on that entire dashboard every single day. So we'll only be updating Monday through Friday, but we'll keep watching behind the scenes, and you should keep following chi.gov/COVID-. And then the other really exciting piece of news I wanted to announce is that looking ahead toward tomorrow and celebrating that, there are some museums in Chicago that have, as part of Open Chicago, signed on to be open late, just one evening only, and that will be Friday. So want to thank and welcome folks to evening at the Field Museum, Shedd Aquarium, the DuSable Museum, the Museum of Science and Industry, and the National Museum of Puerto Rican Arts and Culture. So thank you to those museums. And if you're looking to celebrate Open Chicago, you have the opportunity tomorrow through 9 p.m. To celebrate that at some of those museums that also, like other settings across Chicago, will be able to be at full capacity.
Yeah, which is wonderful. Because our museums had to be closed for a little while.
They did. It's been really hard. We really treasure our museums here. They're one of, I think, we're known around the world for Chicago's museums, and it's really exciting to see them all coming back.
Yeah, so thank you, museum friends.
Yes.
And thank you, Chicago, for getting us to this place.
Absolutely.
And we're going to keep up the good work and make sure that we protect as many people as possible.
Yeah, we will be doing some additional announcements tomorrow in the setting of reopening, so look out for press conferences or press announcements related to that, because we are really excited about it. And then I just wanted to note, we won't be on Facebook next Tuesday. I actually am taking a day off, and so but we'll see folks back next week.
Good for you.
Good for me, exactly.
All right. Next Thursday it is.
Next Thursday. Anything else? All right. I wasn't sure if you had good news also. Sometimes you do. Okay.